Modern Athlete, and welcome to another one of our Modern Athlete Live Learn How to Run Well mini broadcast sessions. If you've been watching a few of these before, you know we're doing these to try and bring you advice in various fields of different types and different formats to try and get you guys and girls to run more comfortably and run longer, run further, run stronger. So tonight, before I go any further, of course, we've got to say thank you to our sponsors. These sessions are brought to you by Traumeel, and Traumeel is your reliable running partner. They've got a whole range of wonderful products out there that can help you in terms of injury prevention and treatment. I've used them myself, so I highly recommend them. And these sessions are just designed to be short, informative chats with somebody in one of the fields that we cover in the magazine. Tonight, I'm joined by Dr. Brad Gelbart, who is a Joburg-based orthopedic surgeon with a specific interest in orthopedic sports medicine. In a nutshell, what he focuses on is ensuring that sportsmen and women can enjoy the benefits of sport, whether you're competing at a professional or a social level. So first things first, Brad, before I start giving you the CV and all the accolades and everything that you've achieved, good evening and welcome to the show.
Sure, thanks for having me. It's a pleasure to be on the show and talking to fellow runners. And I've no doubt that talking to you, I'm going to learn something also tonight.
I think I'm going to be the one who's learning things. In between, obviously, the normal medical work that Brad does, he's a clinical director of the Wits Sport and Research Group, known as WISH. It's a special interest group for sports medicine at the University of Wits, where he also lectures in the Department of Orthopedics. He's also a founder and director of the Johannesburg Orthopedic Sports Medicine Institute. He's a director of the Center for Sports Medicine and Orthopedics in Rosebank, and he's an associate of the Linksfield Orthopedic Sports and Rehabilitation Center. That's one heck of a mouthful. It sounds like you have a very, very busy working career there.
Actually, these are my hobbies. I love doing what I do, and they're just different areas that I can enjoy my passion. So, yeah.
Okay. Well, speaking of hobbies and enjoying passions, I also know that you are a Comrades Marathon runner. You have done half Ironmans. You've done multiple cycle tours. So can you give us a few highlights of some of your own sporting endeavors through the years?
Yeah. So I've been very lucky to have some endurance genes. Not the fastest or the quickest, but got a silly mind and can hold on there. So I can proudly boast a sub-3 hour August on the 109k route, a couple of Comrades Marathons, which I'm very, very proud of. And recently I ventured onto the off-road circuit and did the Otter Challenge, which was really probably the hardest thing I've ever done. And this year made it to New York for the marathon. So those are just a couple of the highlights. And I'm very privileged to be able to try and attempt these things, and please, hopefully I can do many more.
I can't help but ask him, in terms of the Otter, given how many steps you have to do on rough terrain with a heck of a lot of pressure for timing, did the knees hold up all right on that one?
The knees were great. The quads, though, were buggered.
Story of every runner's life.
You know, one thing we don't have in Joburg are steps and mountains to climb. So for those of you who do off-road running, you go to Westcliff Stairs, it's probably your closest you're going to get, and it's nowhere near enough.
Mm-hmm.
Yeah.
So let's kick off then. I've got a few questions I prepared, and my first one is, it's my second question. As an orthopedic surgeon and an expert on knees, do you ever find yourself during a run or a cycle or a triathlon, do you find yourself listening to your knees and feeling the clicks and thinking to yourself, oh, that's not right? And the reason I ask is because that's what us normal runners have to go through, and we don't know what we're listening to or feeling.
You know, knowledge is a very powerful tool, but a little bit of knowledge can often be dangerous. And when we're seeing patients, when I'm examining people, we take time, we take a history, we examine, we do x-rays, we do MRIs, we do a fortune in order to get to a diagnosis. When I'm running or cycling and my knee's sore, I do none of those. And so therefore, I just ignore it, actually. I just run through it because pain is your friend. and you push to the end, and we'll look for red flags. And we'll talk about those later, but things like swelling, night pain, that's when you get worried. Fortunately, I haven't had them yet. But when I'm in the game, I ignore them, push through the end. That's all that matters.
So that begs the obvious.
Sean? I think Sean went for a quick run. Hopefully he'll be back soon.
Hi, Dr. Brad. Sorry about that. To everyone on our Modern Athlete Facebook page, it's Roxanne. I'm usually behind the scenes, but I will jump in here until we can get Sean online. As everyone is aware, load shedding is not our friend, and unfortunately with load shedding, it takes away a lot of the signal. Brad, you were sort of going into the conversation about, you know, being a self-diagnosis when you're running, but you know, is it a case that you often feel runners should be coming to you sooner rather than later?
So before we get on to coming to me, I think there's an important principle that I want to get to all our runners over there, that are out there. And we call it the pain robot. And although I flippantly said that I just push through and run through, there are times when one should be responsible, I suppose, and stop or walk or pull out. And really what we do is we grade pain from 0 to 10. See Sean come back. So I'm just going to finish this thought if you don't mind. So we grade pain from 0 to 10, where 10 is the most excruciating pain you've ever felt, and 0 is obviously that great down the road when you've got no pain. And we say that if your pain's 0 to 3 out of 10, you can push through and continue going. If you're hitting 4 or 5 out of 10, you should slow down. And if you're hitting 6 and above, then you should stop. Now, I know, and many of my running friends will tell me that at 18 Ks on the marathon, you pop 2 Sign-Leave tablets so you don't feel that pain. I'm a great believer that if you're silly enough to run these sorts of things, you should feel the pain. But a lot of people will do that and will analgesize themselves, which is fine to some extent. But yes, sometimes running through pain is doing more damage. The problem is that it's very difficult to tell while you're running, if you are or you aren't. And as we all know, any comrades runner out there knows somewhere along the line you're going to be sore. And if you had to stop every time you got sore, there'd be no one finishing comrades marathon. And I suppose that is the challenge of what we need to discuss, and how we find that happy medium, that we're not doing more damage, and we also completing our races and being happy runners.
First of all, sorry for me disappearing there. Load shedding, I think everyone understands that right now. Every now and again, signals drop and batteries run out of power and things like that. I'm not sure what happened, but I'm glad to be back. I didn't hear that whole answer, but what I did catch up on, I wanted to ask a related question, and let's just jump straight in with this. A couple of years ago, I interviewed a guy here from the Cape Town area who ran the Comrades, and he was a novice, and he didn't really know what was going on. So, of course, he was taking advice from anybody and everybody that could give him something. One of his clubmates said, have you got your Myprodols? And he said, like, sorry, what do you mean? And the clubmate said, no, I always take a couple of Myprodols with just in case it gets really, really sore. So this guy, let's call him Mark. That's his real name. He doesn't mind me telling you because the story is famous. He proceeded to take a whole box of Myprodols with him on the route. And he decided that prevention is better than cure. So let's have a Myprodol early in the race. And that, of course, made him feel so great. So then he had another one and another one and another one. And I actually can't remember the exact number that he ended up swallowing, but it was a heck of a lot. And when he got to the finish line, he felt like $1 million. About 10, 15 minutes later, his mates were carrying him to the medical tent. And when the doctors interviewed him before they started treating him, they said, have you taken any painkillers? And he said, yes. Why? And the doctor gave him a very stern look, like, that's not right. You shouldn't be doing that. So he lied to the doctor because he was too embarrassed to say he'd had about 10 mipridols. But what you were speaking about there, sorry, and can I just add, he was fine, luckily, but he learned a very important lesson out of that. In terms of painkillers during races, I mean, I've read so many times and heard so many doctors say that it's a no-no because the body's way of telling you something's wrong is pain. So what's your take on that in terms of painkillers or pain medication during a long endurance event?
So I'm a great believer in evidence-based medicine, and we need to look at what really happens. And there's different evidence that shows that using anti-inflammatories, which mipridol's got anti-inflammatory in it, is not good for the kidneys. I mean, people who take anti-inflammatories every day of the week without running marathons do get kidney damage. Now, we also know independent dehydration and chronic dehydration is also bad for the kidneys. So combining the two, both anti-inflammatories and dehydration, plus muscle breakdown and myoglobin, really is what we call the renal stress test. You're testing those kidneys to their limits. And if you really want to knock off your kidneys, that is probably the best way to go. However, there are some painkillers that don't include anti-inflammatories that are metabolized by the liver. Your Panados, your Tramacets, your sun leaves, things that don't have anti-inflammatories in them. And like I said, I'm kind of out the loop a little bit, but it seems that taking these painkillers is very common in the running circles and running. And I don't seem to see, certainly not from an orthopedic point of view, many people having severe issues. And I'm not reading articles about major liver failures and issues with these. So I need to go and look at the evidence for it. But I certainly don't think taking an opioid-based painkiller, other than make you a bit mad and a bit drowsy, is going to knock off anything else in the body, and you probably are safe to do it.
Okay. Well, on behalf of Mark, the microdol man, thank you for that answer. So getting back to what I was talking about before I lost signal for a minute, can you give advice? Well, sorry, let's rephrase that. What are the benefits of running? Because one of the biggest questions we get asked all the time, especially by friends and family who don't run, is running actually good for you or is it bad for your knees? So you're talking about the benefits of impact loading on muscles and joints. So take us through that, please.
Running has been shown to be very beneficial on a number of levels. First of all, cardiovascularly. So in terms of time versus effort versus heart rate increase, running is extremely efficient and effective to get that heart rate into your aerobic and even briefly into your anaerobic zone, which allows you to build up fitness. And you can do it for a relatively short time. You can pick up a pair of shoes and go for a 30-minute run, and that's more than adequate. So that's a really good aspect of running. The second thing is the impact loading. Your bones, in particular, respond to stress. The more load you put on them over a controlled period of time, the stronger they're going to get, and the better your bone density is going to be. And we know that from the age of 35, we tend to lose bone density. So if you can build your bone density up as high as you can before that, then when you start decreasing, obviously you've got a higher starting place. There are genetics involved as well, but running has been shown to improve or decrease lumbar osteoporosis and femoral neck osteoporosis in elderly people. And so therefore, there's no doubt that impact loading and running is very good for you. Not said walking is not good either, but I think from what I understand, running is slightly better if you can. If you can't run, walking is good. Cycling, the only impact that happens in cycling is normally when you hit the other guy in front of you or the ground. But cycling is good for muscle and to take load off joints, and very good for cardiovascular fitness. But running for bone metabolic health is very good.
So we've established that running is good for you. Now the problem comes in that, unfortunately, overuse or long-term wear and tear injuries do occur. So I'm a runner. I've now discovered my knees are making horrible clicking sounds. And where does one start? you're an orthopedic surgeon, and there's always been this sort of, I wouldn't want to call it an unwritten rule, or I wouldn't want to call it a rumor. Just you often hear people saying, yes, but the surgeon is the last resort. First, go see your GP, and if not, then the physio and everything else, and you're going to see the herbalist and things. But the surgeon should be last. What is your take on that? Because, sorry, before you answer, the counter to that is that some people actually believe that if you go to a surgeon early, instead of waiting till the problem is 10 years down the line and needs massive surgery, going early is actually better for you. So jump in. Give me some guidance here, please.
Wow, it's a tough question, because if I say never see a surgeon, then I'm never going to get business. And if I say always see a surgeon, then I'm going to be accused of trying to hunt for business. So I need to try and find a balance. But in reality, in South Africa, in most of our urban centers, we're very, very well stocked with excellent sports knowledgeable people, from your chiropractors to your physios to your biokineticists to your one or two homeopaths, and to your sports physicians or GPs who specialize in sports medicine. And a lot of these people have an interest in sports, and many of them are sports people themselves. Having said that, not many, a car's not a Ferrari is a car and a Fiat's a car. You can decide which one you want, right? So a physio and a physio are not always the same, and a surgeon and a surgeon are always the same. But if you've got somebody who's interested, who's consistently attending and updating themselves on knowledge, they're always a good place to start, because they're up to date and they're conservative, and they're going to look after you, and they're going to know when to refer. As a surgeon, I like to see people who need surgery. However, I do spend a lot of my day counseling runners, because I get many people coming to me saying, well, my knee's clicking, what do I do? Well, you don't need surgery, so you don't need me. And they look at me and they go, are you joking? Help me and fix me. And I'm going, but actually, I make money from fixing you, and I'm telling you, you don't need surgery. So take that and run. And I'm happy to see those people as much as they want to see me, but there are many, many other people, other facets of the sporting world to see. We run in Joburg, do a little plug if you don't mind, for the sports rehab and physician people. We run an annual monthly education series online, where we go through different sporting events, different sporting injuries, and we try and educate and learn from each other about what the latest trends are in all these things. And we get a regular good audiences, and together from Josie and Wish, we try and ensure that certainly in the Johannesburg area, and now because we can do it online, countrywide, as many people as possible are aware of what to do. And the challenge is and really the real challenge is that many people don't want to let go. So the key is, you may go to a physio first, and you may do 3 or 4 sessions. And because you're not getting somewhere, the physio may say to you, and I'm sure I'm choosing physios, but it might be many other people, let's keep going, and they'll push you and push you and push you until you're out of your benefits, and you're not going to get anywhere. That's the physio I don't want to be at, because you're not making progress after 3 or 4 sessions, or you've got a definite plan beginning. Then you need to be looking somewhere else, and then you need to go somewhere else in the chain. So whether you start with a chiro, physio, bio, physician, GP, your running friend on the side, or with the orthopod, you want to start with somebody who's going to be able to guide you and know when they've reached their limit of knowledge. And we all have a limit of knowledge, all of us. Well, I don't know how to do manipulations and physio and spine chiropractics, and I've got no idea. And when that needs to be done, I refer you on to somebody else, and vice versa. When you go to somebody else who's not sure of where to go, and it's important that they recognize that, and that you recognize that, and phone a friend, as I always say. What I do want to mention, touched on earlier, is the red flags. In the knee in particular, there's 2 or 3 things that really need to be looked at by somebody who's going to be able to investigate further, like a surgeon or a sports physician more regularly. And things are, if your knee swells up, it's tight and swollen, you get lots of fluid in your knee, that's a red flag. If your knee locks, that you can't make it straight, or you've got a history of injury where you twist it and you feel something catching the knee, and it swells, that's something we need to investigate. If your knee feels unstable, like it wants to give way, and you've had a previous injury, we need to investigate. Most other things, the last one is pain. If you get pain at night while you're sleeping, that's a red flag. So let me go through those again. Pain at night while you're sleeping, a big swollen or fused knee, or fluid in your knee, locking where you can't make your knee straight, or you feel there's something catching in your knee, and instability. Then a sports physician or a orthopedic surgeon with an interest in sports or knees is definitely your next protocol.
Well, I'm very happy to report that I've got none of those problems. Through the years, because I played soccer as well as undertook running, I tore my ankle ligaments many, many times, but I was lucky with my knees. And ironically enough, years later, my girlfriend says to me, "You used to coach a women's soccer team, so will you teach me to kick a soccer ball?" So I said, "Sure, no problem." And I side-footed the ball towards her the first time we went and kicked the ball. And next thing I knew, my knee was incredibly sore. And turns out I'd torn my meniscus. So that made me realize that you can do something over and over and over again for many, many years, but you stop doing it for a couple of years and then expect your joints just to do the same thing all over again, and they can't handle it. So in terms of practical advice for fellow runners, do you have recommendations of how runners can maintain the health of their muscles, their joints, their ligaments, the tendons, and everything that make up the important joints, notably the knees, because that's your area of specialty, but the same thing applies to hips and to ankles and everything else that we use when we run. Do you have those handy tips that runners can use?
So there's two things to look at. One is joint health and wellness, and the second is muscular tendinous joints, or muscular tendinous health and wellness. Joints, particularly the hips, the ankles, the knees, the weight-bearing joints, which is the ones that runners consistently fit. It's important that those C-load and C-load appropriately. If you've got a previous injury where you've torn cartilage or you've torn ligaments, ankle ligaments, by the way, heal very well. The ankle's a very stable joint, they heal very well, so we're not too worried about that. If you've torn knee ligaments before and you really want to start running, often it's good to have an assessment, just make sure there's no underlying problem, and then go from there. You know, a knee is like almost like a pothole in the road. If the road's smooth and your cars drive over it, they can drive over it for many, many years. The minute you get a small little pothole and you start driving cars over that pothole is going to get bigger and bigger. And once you get a hole in your cartilage or a meniscus tear, and you can then go and load it over and over again, there is a possibility that those may get bigger. And I know one of the things that one always likes to discuss is, well, when do we intervene? When do we go and stop it? Or when do we do surgery? When do we try and prevent that hole from getting bigger? Well, that's a discussion we need to have looking at on an individual basis. All the evidence for joints shows that if you start slowly, load it, and prevent it from swelling, and you don't have a pre-existing injury, you can push that joints as far as you want to go. And so joints are one thing. Muscles and tendons are a separate issue because they rely on stretch and pull and forces and contraction. And I'm sure the physios will tell you, but I can say at a personal level, stretching is the most important thing you can do as a runner. Probably the one thing that we don't do. Right? We go for a run, it's been like a run, we stop, it's time for a coffee, and you're at the coffee shop, and the last thing you want to do is be bending over, showing somebody your backside while you're stretching your hamstrings and looking all hoity-toity. But actually, 5 minutes of stretching after a run, when you're warm, is absolutely imperative. Sometimes even in the middle of a run, after a kilometer or two, when you're nice and warm, just stretching a little bit, getting those muscles nice and loose is important. we use the toilet paper analogy. If you decide you want to go and pull it, the roll of toilet paper, you put it slowly, you can put it all day and nothing will break. But go and put it fast once and you'll tear with the toilet paper. And the muscles and tendons are no different. If you load them slowly, you can load them for almost forever. So just remember that next time you go. Don't do anything too quick. Don't be explosive. Make sure you're nice and warm and ready to react when you do. And don't forget to stretch.
I must say, I've rather enjoyed this conversation because I've now learned about potholes in cartilage and the toilet paper analogy for stretching muscles. Two things I've never heard before. This is nice. So when you are running in a race or doing a half Ironman and you're chatting to the person next to you and they find out that what you do for a living is orthopedic surgeon and specializing in knees, do you find yourself suddenly becoming the doctor on duty in the middle of a race?
I'm not very talkative in races. So, but yeah, I wherever I go for dinner or even on the road, sometimes I'm running and a lot of my patients run past me and go, hey, how's it? How's it? And that's actually had a lot of follow-up because I get to see how people do after we fix them. In fact, I ran the New York Marathon with a patient of mine, a friend of mine, because he was lying in hospital and he said to me, Brad, I'm going to run again. And I was just, you could see there was emotion on his face. And I said, yeah, I'm sure one day you'll be able to run. He said, okay, well, we're going to New York. So we're going together. And I half said, yeah, okay. Anyway, because of COVID was delayed, but 7 years later, we ended up in New York together running the marathon. So there are a lot of people out there that do stop me from time to time. And vice versa, I stop lots of people out there and ask them advice too.
Okay. So on that note, can you actually spot when someone's got a serious problem just by watching them run?
Yes.
That's a trick question because I think we've all got a problem up here.
No, so I was just going to say, and I'm sure most runners who run behind me will say I've got a problem too. So, yeah.
Well, Brad, thank you very much. It's been a really informative chat. As I say, just to hear a fresh take on things and using easy to understand analogies or examples that a lot of people can relate to. I mean, the potholes in the toilet paper are just brilliant. So thank you very much for that. Folks, we're going to wrap it up there because, as we say, we like to keep these Modern Athlete Live Learn to Run Well sessions some short and sweet and informative. But of course, if you have any questions, pop them through to us on our various platforms and we will happily answer them if we can. If you've got the questions for Brad, we'll pass them on to him. Obviously, we're not promising his services to everybody, but if there's a good question that we think is worthwhile following up, we'll do that. Brad, anything, those last advice, tips you want to give to the runners and the message to them?
So, yeah, I think, first of all, thank you for having me on this. It's been an absolute pleasure talking to you, and I've learned a portion of what goes through the minds of a runner. The challenge that we have, and many people come to me and say, I saw a doctor who told me that I should never run again. And the challenge that we have is that running is so good. And when you spoke about the benefits, I never spoke about the psychological benefits. Mm-hmm. One of my colleagues, friends, people used to tell me that running was his antidepressant. And running has got such a good psychological benefit for so many people that I honestly believe that my role is to get people back to doing what they want to do. It's really easy to say, don't problem or hit problem in front of you. But in reality, what you're doing is you are taking something very, very important away from people. And to understand that we as runners want to be running, whether it's 5Ks or 10Ks or 160 kilometers, or it's a sky run or you name it, we want to be getting out on the road with our mates and talking and feeling good. And so I'm very privileged to be in a position where I can help people with their lifestyles and save lifestyles, not save lives, and get people back to running safely, in the right place, with their bodies doing the right thing for them. So thank you for listening. Thanks for being part of it. I hope everyone took something out of this. And I'm more than happy to answer questions, and you can share my details. And I'm happy to come again in the future if you want, and we can take some more questions. it's a topic I love. I can talk about it for many, many years. So well done to what you guys do, and keep promoting running.
Thank you very much. So, folks, that's the end session for today. Once again, you've been watching a Modern Athlete live session brought to you by Traumeel, and we'll be bringing you more guests and more handy advice in coming weeks. So stay tuned, and until then, thanks a lot, Brad. Thanks a lot, and we'll talk soon.